If you feel like the coronavirus pandemic is never ending, you're not alone. Over the past 2 years, the pandemic has more than taken its toll on the world. Hundreds of thousands have recovered globally, but over 5.7 million people and counting have died of COVID-19. We've made significant progress by continuing to mask up in public, taking advantage of vaccines, and practicing good hygiene. But the longer we fight against COVID, the virus will continue to mutate. So how does the latest variant, Omicron, compare to previous variations? Since it first appeared in November 2021, Omicron has spread rapidly across the globe and is widely considered to be the most contagious variant. Even those already vaccinated against COVID can become infected and continue to spread the disease to others. Although the elderly and immunocompromised are still the highest risk groups, Omicron is a risk to anyone, with record numbers of hospitalizations occurring in the US. So what are the symptoms? The symptoms of Omicron are the same as previous forms of COVID. Many experience cold or flu-like symptoms, congestion, difficulty breathing, coughing, body aches, and fever, as well as nausea and vomiting and loss of taste or smell. But even without symptoms, you may still be a carrier and able to infect others. The good news? Testing is easier than ever. Health departments around the US can provide locations where you can get a free test, and self-tests are available in most drugstores and online. If you do test positive, make sure you take steps to protect others. Stay home as much as possible. The CDC recommends isolating for a minimum of 5 days and avoiding contact with others in the following days. As with all viruses, prevention is key. Continue to follow CDC recommended preventive measures. Wash your hands thoroughly and frequently. Use soap and water and scrub for at least 20 seconds. And use hand sanitizer when available. Wear a mask in public and ensure you're always wearing it correctly. Your nose and mouth should both be completely covered. Social distance. Try to stay at least 6 feet away from others when in a public space and limit gatherings and outings. And of course, get vaccinated. COVID vaccines, including boosters, are safe, effective, and free to the general public. We all want to get back to normal. Taking these simple measures is a way we can each do our part to help end the COVID-19 pandemic, so we can all get back to doing the things we love with the people we love.